I'm Dr. Kelly Rabaza for Beaches Health Group here in Toronto. Today I'd like to discuss some of the common complaints that we see in our office, how we treat them, and some tips on giving you home care. Today I'd like to talk about the hip flexor and how important it is to the low back mechanics. The reason they're called the hip flexor is because when that muscle contracts, it'll either bend your trunk or it'll flex your hip forward. The biggest problem with these muscles is because they're overworked with prolonged sitting and prolonged driving out there. So many people have contracted and shortened those muscles over length of time that those muscles are chronically tight and short. So we're now going to take that muscle and try and release some of the tension on that hip flexor muscle. I'm trapping the muscle in a shortened position, and then we're dragging the muscle underneath my contact through a range of motion. Each time we make a pass over that hip flexor, it gets a little bit longer and a little bit easier to stretch. So we're going to fatigue that muscle by doing a PNF stretch, and I'll get deeper to push up in my hand with your leg, and then relax. So we're resetting the tension on that muscle by having her fatigue the muscle, and then we stretch it again. Push and relax. We're going to finish with a home care stretch for the hip flexor muscle. I'll have you lunge forward at me, straighten your back leg, bring your arm forward and up, and kind of turn and bend back. So you really are pushing your hip through that muscle and lengthening that hip flexor stretch. Remember, if you're a sitting person at work or a driver, this is going to be a great stretch for you to lengthen that hip flexor muscle.